And you're muted.
Oh, did you get some sleep last night?
I did. I
You
did.
feel all fresh and refreshed?
I'm so ready for this.
All right, good. Well, let's hope I am too. I got so many notes. See if I can keep them all together. Well, since we've got a few minutes, I'm going to go get some coffee. I'm going to mute myself again.
I agree with that. All right.
Morning.
Good morning.
Good morning.
Hi, everybody. Hi, all. Thank you for signing in the chat with your agency affiliation. That's super helpful for us later with the minutes. We got a couple more minutes to let people join us. So Anne, you have 3 out of 4 board members are here. I think that's, yeah. So okay, so this is a regular meeting of the Champaign County Developmental Disabilities Board. I am at the Shields Carter Room. Oh, here comes the 4th board member. Everyone is here.
All right.
So I'm in the Shields Carter Room in order to ensure our alignment with the revised Open Meetings Act, the emergency revisions of the Open Meetings Act, which continue right now. The board president of the DDB and the board president of Mental Health Board decided that due to the COVID risk and also the sheer number of people required to attend these meetings today, because these are special meetings, that it would be better for us to remain remote at this time. As far as we know, we will be in person in May. So that'll be a big shift. But this might be our last remote meeting. Hoping. So anyway, I think people continue to enter, and I'm going to mute myself and just keep letting them in. If folks can sign in the chat with their agency affiliation, that would be great. And you can start whenever you're ready.
Okay, I'm going to call the meeting to order. Stephanie, could you please do the roll call of the board members?
Deb Roosh.
Here.
Georgiana Schuster. Georgiana, you're muted.
Here.
Kim Fisher.
Here.
Ann Robin.
Here. Okay, Zoom instructions. Everybody that's here probably has the Zoom instructions. And as Lynn said, please sign in the chat. and welcome to everybody. I want to go to approval of the agenda, but I'm going to add one thing to the agenda before we approve it. We're going to add in the traditional agency reports and successes at the end of the meeting, rather than its usual position at the beginning because of this special meeting. So that will be added in at the end. And I anticipate this meeting will be about 2 hours long. Approval of the agenda with the addition of what I just said.
I'll move to approve as presented plus Dr. Robbins' addition.
Come on.
I'll second it.
Thank you. We got to move forward here. Okay, we have to have a roll call for this.
Georgiana Schuster,
Yes.
Kim Fisher,
Yes.
Deb Rush,
Yes,
Ann Robin.
Yes, okay, we have an agenda. Now, the next item is citizen input, public participation, which is, of course, a very important thing for this board to do. Is there anybody that has anything that they need to say this morning before we get started on our busy agenda? Okay, I'm going to move on. And the next thing is chairperson's comments. And I'm going to make some very brief comments, and then I'm going to turn it over to Kim Fisher and Deb Rush to make a few comments about what happened with the county board meeting last week. And Georgiana Schuster wants to read something into the minutes from the They Deserve More movement. So that will be following my remarks. I just want to say we have almost successfully completed the sale of the second property. And I would consider this to be a win-win situation because the buyer is DSC and they're going to use it to house people with IDD needs. So I feel really good about that, taking a tough situation and turning it into a win-win. And then the second thing I want to say is major thanks to the staff. We always thank the staff, but major thanks right now for the excellent preparation for this meeting. I felt like the online access and the paper documentation and the summaries were even better than usual and made my job much easier in terms of doing this review. So I want to thank the staff. And that's my remarks. Kim and Deb, would you like to take a couple of minutes and tell us about the presentation to the county board meeting?
Kim, do you want to address?
Sure. So thanks, Dr. Robin. Thanks, Deb. So we submitted a memo. Well, Lynn submitted it on behalf of everyone to request that the county board consider using the American Rescue Plan Act funds for hazard pay, premium pay, excuse me, for DSPs. So we had presented a package of information to the county board at the committee of the whole last week. I spoke at the meeting, Lynn spoke at the meeting, and I believe Becca, sorry, Becca, sorry, from Community Choices. Can somebody help me with her last name?
Obuchowski.
Thank you. I apologize, Becca. Obuchowski. Thank you. I have a complex last name, so I should be able to do it. Anyways, so the three of us spoke about it, but we had representatives from several people from DSC there. So the county board received that information. They, I think one of the county board members asked kind of where this money would be kind of coming from. And, but there were not that very many questions about our, we weren't really officially asking anything. We were just kind of putting it on their radar. Several board members thanked us for putting together a very informative packet and for the advocacy work that we did, which was very nice. And then we decided that I think as a team that what our next plan is to submit a formal memo to the county board for their next meeting, specifically requesting funds. So we're kind of mapping out a plan for what it is, the language that we're going to be using from the regulations to kind of build or boost our case, as well as some specific financial numbers. So we're working with some of the agencies about what those numbers might look like. Did I capture everything, Lynn and Deb?
Yes, yes, thank you, Dr. Fisher.
Thank you for that report. Georgiana, did you want to read the statement into the board minutes?
I will. It's rather a long, it's an email that I received from an organization called They Deserve More, which has been doing a lot of work about caregivers and DSPs and so forth. And they solicited anybody they could to send in witness slips and send in letters to their legislators and so forth. So this is the letter sort of recapping what happened at the end of this last Illinois legislative session. It said the Illinois General Assembly adjourned its spring session in the wee hours of Saturday morning, April 9th, and approved a robust FY 2023 budget for the state. Throughout the session, we advocated for the legislature to include $246.8 million in new state funding to support people with disabilities, which would fully implement the Guidehouse rate study recommendations for FY 2023. However, the final budget appropriated Governor Pritzker's original $94.8 million increase for Guidehouse related investments. So it says, your continued and passionate advocacy efforts over the last few years have helped secure incremental increases and brought the needs of the system to the governor's attention. Without this advocacy, the governor would not have originally proposed such a significant investment. Despite this increased funding for the next fiscal year, however, it falls well short of what is needed to stabilize the community provider system, solve the staffing problems, and allow for future expansion of services. Guidehouse clearly laid out the investments needed to begin the work of repairing the system over a 5-year period. In a year of positive state revenue projections and an estimated $2 billion added to the governor's proposed budget by the General Assembly, we consider it a missed opportunity to have not fully funded the Guidehouse recommendations for a second year in a row. Last paragraph, the FY 2023 budget passed this spring will help prevent a collapse of the system, but we do not expect the situation on the ground to materially improve for provider agencies and the people they serve. Rather, we are deeply concerned that agencies will continue to be forced to close or consolidate homes, end some programs altogether, and turn away people seeking services. It doesn't matter how many people come off the state's 14,000 plus wait list if they can't find a provider with the funding to serve them. So to sum it up, they're saying, please know that we are enormously grateful for your support and your advocacy over the years and this year. While we didn't get all that we wanted, we came out in force with thousands of witness slips and filed thousands of notes to legislators, and that matters now and for the future. We had several legislators actually asking us to stop the flood of email Yay. Many legislators argued strenuously on our behalf during the budget negotiations, and we are enormously grateful for their support. This goes on a little bit more, but this is basically, this is the end. We are focused on the next phase of our advocacy and hope that we can count on you for continued support. Do not be discouraged. Let's use our energy and concern toward even greater results in the near future. So I wanted to read this just to let you know where everything stands in the state budget, but also to give you a sense of hope, even though they didn't pass the whole 246 million. We did do some good with all our letters and witness slips and so forth. We did do some good.
Thank you, Georgiana. That was very good. Lynn, do you want to make a few comments?
Yeah, I can keep it short. I really appreciate this detour from our normal comment because this is really important. And I love what Georgiana just read because when I read it, I thought, oh yeah, I can't be like constantly negative about what's going on because this was a huge advocacy effort and it worked. So, but what I'm tuning into is stuff like now people are saying, oh, there will be 700 people selected from puns. And, so problem solved. Except it's got nothing to do with the size of the problem. And for Champaign County, that might translate to 8 or 9 selections. And as Georgiana read and elaborated, if there are not providers the capacity to provide services to those 8 or 9 people, those 8 or 9 people are going to develop a service plan that matches the capacity that's available, not necessarily what's going to lead to their best life. So we have a lot of work to do. And I think it's okay for me to keep saying that. And also for me to acknowledge at the same time that the awareness piece builds more awareness and that's an anti-stigma tool. And that a lot of what we're doing here is working against the tidal wave of dehumanization of people with disabilities, which has been compounded with the way we talk about the COVID pandemic. So, so thank you, Georgiana, for giving me like a little bright light I can shine, but while also being, incredibly critical. Okay, moving on. This is a really jam-packed meeting, lots of information. I did put the link to the board meeting packet into the chat in case anyone here doesn't have it. I'll try to show it on the screen as we go through. During the discussion, which will be led by board members of the review of each application, it's possible that agency representatives who are all here, thank you so much for coming, will know the answer. And so we just want to make sure to, follow protocol. This is a board discussion. We only jump in when board members ask us to. And I want to encourage the board members, the folks that have information appear to be here. So if it gets tricky, let me know and I'll try to do a better job of finding who needs to be talking. But I know sometimes it's been hard to find a balance one way or the other, especially with only a couple hours to go. Thank you, Anne, also for your shout out to the staff work. Those program summary, the long form program summaries were a collaboration. Everybody on the team put their special knowledge into those documents. And then Kim Bowdry did the short forms so that y'all could have something right away. And she sent those out to board members as quickly as we could turn them around. So we did it a little bit differently this year, but I love that it was a real staff collaboration and everyone, worked to get these done kind of in advance of our normal timeline, which has been really good given our remote times and occasionally the slowness of mail and machines breaking down when we need them. So anyway, that's all I've got. Thank you. And I hope to let me know what I need to do to help keep things smooth today. So
we will. Thank you, Lynn. Okay, the next item is approval of the board minutes from our March meeting. Can I have a motion to approve?
I'll move to approve them as presented.
Second?
Second.
I'll second that.
Okay. Any discussion about the minutes? Only one comment from me. Thank you again for excellent minutes. And let's have a roll call to approve the minutes.
Oh,
Alec Fisher.
Yes.
can I interject something here? I did find one minor mistake.
Okay,
Well, it's the handwritten page 6 under SELA update. It looks like I moved and seconded a motion, and I don't think I can do that. But that's the only mistake I found.
Oh, okay.
I'm not really sure what to do with that. Stephanie, do you have any advice?
Yeah, I'll go listen to the recording and make that correction.
All right.
Okay, thank you. All right, thank you for that correction. Are we ready for roll call?
And so can we approve the minutes then? If we
I
don't,
think we can approve the minutes. Yeah, I think we need to move forward. If anybody feels uncomfortable with that, I suppose we can defer that and approve the minutes at our next meeting, if we feel like we need to do that.
Maybe we can approve the minutes knowing that they are going to be amended.
good idea.
How's that?
Works for me.
Yeah.
Did I make that motion? Do you want me to fix it? I can say, motion to approve the minutes as presented with a correction on page 6 regarding motion 1 under SILA update.
I'll second.
Yeah. All right,
Kim Fisher,
Yes.
Deb Rush,
Yes.
Georgiana Schuster,
Yes.
Ann Robin.
yes. Okay, thank you for that. All right, the next item is vendor invoice list on page 8. And this also requires board approval. I have one comment. I want to thank, is it Chris, for the new, easier to read format. And I'm open for a motion to approve the list.
I'll put in a motion to approve the list. This is
And
Kim.
I will second the motion.
All right, any more discussion? All right, Stephanie, you want to do roll call?
Deb Rush,
Yes.
Georgiana Schuster,
Yes.
Fisher,
Yes.
Ann Robin.
Yes. Okay, now we are going to move on to the meat of our meeting. And that is the new business. The first item is really information only, and it was requested to present characteristics of people served in fiscal year 21 and allocations per priority of 21. And in the printed board packet, they came out black and white and gray, which makes them a little bit hard to see. But the beautiful color that is available online is being demonstrated by Lynn right now. So this is for information only, and we just want to make sure everybody knows that this is available online in the board packet and on the website. And I think Lynn and I discussed yesterday that the staff actually has this kind of information and can make this kind of thing available again on request. So whenever people have a request for that kind of information, it can be put forward in this very easy to look at format. Any other comments about this presentation?
So this is Kim. This is Kim. I just want to thank, that was so responsive of the staff to put together such a great report and make it really easy to understand. So thank you so much for literally the next meeting immediately responding to this information and presenting it in such a digestible way. So I really do appreciate it.
Oh, I think Kim Bowdry had this done the next day.
Wow.
She got on it. We messed around with pie charts to find the prettiest one. I'm sorry that your board packet is not in color. We did post this on the website so that is available to the public under public documents on the county's website, our page. Just because it could be a question that people have. Anyway, okay.
Okay,
Um,
thank you for
Can I
that.
just ask a follow-up question, Lynn? So as I was reading the report, like the proposals, like none of that information, none of the race information or the zip code information presented. I mean, there was some information about rural stuff. Where does this information kind of come from? Does this come from their quarterly reports? It doesn't come from the applications, is that right?
It is
Okay.
all from quarterly reports. We used to require it in applications years and years ago, but then it turned out, they're already, so if it's an incumbent program, then they're already collecting the data. So it was quite easy for us to just draw the data from the reports that they have already submitted. So we took it out of the application, which means when you get a new application, you may not have any kind of comparables, but often a new application is for a new program. Which
Right.
wouldn't have the data anyway, or a new agency which may not have had the capacity to collect that data yet. So what you see in the long form program summaries is, and I think, it's validated. This is kind of what like Kim Bowdry and Leanne Bryson do every quarter. They're going through every report and making sure that things match and that it looks true and asking questions. So I think these data are pretty reliable. Just
Great.
if they were, some programs are not able to collect certain information.
Yeah,
So,
yeah.
yeah.
Understood. So thank you for the context, and helpful to know for future questions if I have stuff. That'd be great. Thank you.
All right, well, I think we're ready to move on to our major task here. I counted that there were 15 programs. I budgeted 5 minutes per program for presentation and discussion because I had to do something to kind of figure out how we were going to do this meeting. Some programs may not take 5 minutes. Some programs may take more than 5 minutes, but if we kind of use that as a guideline, we will get done in an hour and a half of discussion. So that's a long time sitting here having discussion. I did not budget a break in the middle, especially Georgiana said she had to leave at 11. We are right on time for what I figured we were going to be able to do. So let's proceed, and please stop me if it feels like we need to have more discussion about things. But other than that, I think we're just going to start, and I'm going to start on page 24 with the application for CCRPC Decision Supports PCP. And I believe I am the primary reviewer on that, and Georgiana is the secondary reviewer. So I will start. And I made a few notes. The CCRPC is the sole provider of what they call ISC, which is Independent Service Coordination in our area. They provide conflict-free case management and information. They define in their application what conflict-free case management means, which basically means case management is done by an agency that is not providing the service. The CCDDB is the sole revenue for this program. Personnel is 72% of the expense, and that is 4.76 full-time equivalents. They are requesting an increase because there is a new program component to fill a gap created by the loss of another provider's program. They serve 651 people in program year 21 and 241 people in the first half of program year 22 with the expectation of 520. So they're really on top of the numbers. And they are very much coordinated and collaborative with other organizations. They did an excellent job of providing virtual service during COVID. They described that. And I guess the only questions that I had for the organization was just if they had a quick assessment as to how well they felt virtual services worked during the shutdown compared to services they were able to do in the past, and what are their plans for returning to in-person meetings and services, and how is that going? So those are my only questions. Georgiana, did you want to add anything to that?
No, but I had exactly the same question. How were services provided during the pandemic? So maybe our agency could just talk a little bit.
Sure, I'm happy to address that. My name's Katie Harmon. I'm the Community Services Assistant Director. And Angela Yost, who is directly oversees this program as our program manager, is also on the call. So we provided services throughout the pandemic using kind of remote capabilities. We use Zoom, phone, FaceTime, just kind of whatever the client and family was most comfortable with and what they could do. When the weather was nice, we did meetings outside, socially distanced. And I will say that, and I'm sure a lot of people can relate, but I mean, it was difficult. There were difficulties for certain individuals that we served as far as accessing the technology. If they needed support, did they have support to do that? You know, it was difficult as well for new clients who our staff were, you know, trying to establish rapport with and get to know. It's just more difficult to do that remotely. But, you know, we did the best we could. On the flip side of that, I will say that we did receive feedback from some families and clients that we served that they liked doing Zoom meetings and the remote meetings as far as accessibility, didn't have to worry about like transportation barriers and things like that. So there were some people who actually preferred it. So at this point in time, we are back to doing in-person visits. We do a health screening 24 hours prior to the visit to make sure everyone is feeling well. If the person we're serving or their family is uncomfortable at this point with us coming into the home, we certainly respect that, and we can still continue to offer virtual visits as a preference of those we are serving. So, but we've found that overall, a majority of the clients that we're currently serving through this program, we're kind of eager to have us back meeting with them face to face.
Thank you. That was very interesting, and we appreciate your comments. Are there any other questions from the board before we move on to the next program? All right. I don't hear any, so I'm going to move on to the next one, which is DSC Service Coordination. And I see Kim Fisher as primary and I'm secondary. So Kim, do you want to take it away?
Sure. So I used I'm not sure how to present that the information because I used the evaluation tool.
Go
and
ahead,
kind of went
however
through.
you want to
Is that
present
okay?
it.
Okay.
I made notes, but whatever you
Okay.
want to do.
Okay, very good. So the service coordination, DSC service coordination addresses people with IDD. They linked to their, essentially the program is, you know, creating links between people with IDD that they serve and different types of government benefits and services that they can kind of access. So they said things like, I can look at this here, like medical benefits, SSDI, SSI, Medicare eligibility, SNAP, etc. Those kinds of things, legal support, housing support. So kind of coordinating all of that information. So if I read correctly, they're proposing to have serve a total of 280 people. 15 new people. They're supporting 265. Is that what you had, Anne?
Yes.
I read that correctly.
Yeah,
Okay.
I didn't write that down. It's buried in there. So,
Okay, very good. They indicated they sustained services throughout the pandemic. They actually talked specifically about using technology to implement services. They didn't address like increased need of technology training for the folks that they are working with or their staff, but they did talk about how utilizing Zoom was essential to delivering services throughout the pandemic. They serve people in the rural communities. I did have they addressed inclusion and anti-stigma, talking a lot about the services that they're coordinating, being in the community, and to help address, just being in the community would help address some stigma. Staff is highly trained, gets lots of, they indicated several trainings around microaggressions, culturally responsive practices, trauma-informed practices, and things like that. The couple things that I had questions for was and I think I had this question for a couple of the agencies. So the CLC, the Culturally Linguistic Competency, is that the right acronym? Okay, so I had a couple questions related to that for the agency. So one of the kind of goals that they talked about was making sure that they, let me see if I can just find my notes real quick. Let's see. Okay. So they talked about their recruiting board members of color, immigrants. Well, I actually had questions. Are they actively recruiting board members of color, immigrants, people from a variety of socioeconomic backgrounds to be part of the decision-making on their board? That wasn't entirely clear. And that was a goal that they mentioned. So I just wanted to clarification regarding that. And then the other thing I had questions about were the, which I had for most of the proposals, were the outcome measures. So like, how are they measuring the outcomes that they are proposing to do? So if one of the agency members could talk a little bit about how they're actively working to diversify their board, having more people of color, or if they have people of color, it wasn't clear to me in the proposal, or immigrants or people from a variety of socioeconomic backgrounds as part of the board for DSC.
I can answer that piece. Yes, I mean, we do currently, but we are always looking to expand our board. We have 3 different boards. This board under this would be just the DSC board. But yes, all of our boards we would like to expand, but yes, we currently have as well.
Okay. Thank you. Okay, and then for the outcomes, so like one of the assessment tools was that the outcomes have to be measurable and observable. So if someone could talk real quick about like how we're defining kind of the outcomes here, like how they're measured. So like one outcome is personal plan will be reviewed monthly, and notes will be taken on individual records. So like if someone's just tracking, like they're reviewing the person's personal plan monthly. And then the other outcome is that a person will participate in a personal outcomes measure interview. And so we're just looking at that they participate in the interview, not necessarily like that what's in the interview is actually delivered for that person. I just wanted to clarify that it's just that they're participating in the interview.
My name is Heather Livingston, and I am the Director of Case Management over here at DSC. Yeah, for the personal outcome measures, they are just making sure that we do those interviews and participating in doing those and getting those interests. We are trying to, carry them over into their implementation strategy when possible as well. And then as far as measuring on the personal outcomes, we're reviewing and looking at, what the QIDP, the case coordinator, has to write a note each month to show that they're continuing to want to work on these outcomes and they're making progress or maintaining Because if not, then, you know, we need to reach out to the ISC and the individual to see what changes need to be made.
Okay. Okay, thank you.
You're welcome.
So that's all the questions that I had. Anne, I don't know if you had that.
Okay, thank you, Kim. I had one other comment. This program has a huge variety of services, everything from assessment to 24-hour crisis support. I mean, it's amazing. And the thing that I wrote down was they had 90% of clients referred were assessed within 30 days and 75% had services within 30 days. And I thought that was just phenomenal as an outcome report. So I really appreciated that. CCDDB is 72% of program revenue. And as usual, I didn't write down what percentage was personnel, but it's mostly personnel that we're supporting. Okay.
I have just one more question. So, because it was one of
Kim,
the
you've got
evaluation.
the next one too.
Oh, okay. So just real quick, like, because it's in the evaluation tool, is the integration of person-centered planning. I didn't see that in this application. I saw it in the IFS application. So I guess I just wonder, is that part of this service, person-centered planning, the service coordination? This isn't just, I guess, me expressing my ignorance about the process.
No, yes, it's definitely person-centered planning. The ISC will reach out to them first, and then, you know, the team will meet with the individuals we serve and make sure we're all working on what they want to work on. It's all part of, the person-centered plan.
Okay, it wasn't, I don't think it was in the application. So
actually, if I can, this is Patty. Kim, on page 3 of the application, at the very top paragraph, the role of the ISC is to do that discovery tool, and they develop a personal plan, and then they give us outcomes that the person's interested in pursuing, and whatever we help to support that person on, we develop an implementation strategy that goes with that personal plan. So that's where the outcomes come from. And I kind of highlighted when I was reviewing just that we develop the implementation strategies to design the approach to support the person to realize their identified outcomes. So that's kind of what our role is in that discovery personal plan process.
Got it. Okay.
Thank you. That was very helpful.
Sure.
Okay.
Thanks.
Thank you.
All right, I'm going to move on to the next program, which is Community Choices, Inclusive Community Support, formerly known as Community Living. And Kim Fisher, you're the primary, and Deb Rush, you're the secondary.
Okay, thank you. So this, my understanding is that this program is about supporting people to live in the community. So to not necessarily live in a SILA or in their family home, but to live in the community where they want, and with as many like customized supports as they possibly can. My understanding is that the people who are in different from, and this is kind of what I got from the different applications between DSC and Community Choices, that for this program, participants, in order to be eligible for the program, they need to be able to be on their own for more than half the day, or sorry, majority of the day. So they have to have, be able to kind of be on their own. I think that's what I read. They provide coordination of lots of different services, and there have been able to do some supports throughout the pandemic, utilizing technology to serve people. But they also didn't talk a little bit about like the kind of next steps for training and supporting their staff or the people that they serve. It was also not clear for me of like how they're working on the cultural linguistic competencies and the kind of the makeup. I didn't see board information here, but it's possible I missed it. So unlike DSC, there was a board, but maybe, so maybe the organization can share that information. They cited evidence for having supported housing and how important that is. Their staff is trained using QIDP services or training, or they're a QIDP professional. They made connections with other organizations. The person-centered planning was throughout this application, so it's kind of like the foundation of the program. I guess I had another question about the outcomes. I hear that that they're not it was not entirely clear about the outcomes, so I'd love for some feedback again. And this is maybe something that, you know, because I think we have that grant with the U of I about collecting and measuring data. And I know the DD organizations, although I think Community Choices has been part of that, that training. But I think that maybe some of the agencies might benefit from kind of writing that up, or, you know, getting some more feedback on how to make their programs a little bit more measurable and observable, have measurable and observable outcomes. Let me just get to the page where we have the outcomes. Okay, so they have 4 different programs. So they talked about being people who identify the different programs can pick kind of from 4 different programs, which is really great. On their outcomes, oh, see, here it is. So they talked a little bit about that, you know, some outcomes are that participants will be maintaining housing over time. They indicate that people are satisfied with their housing. So satisfaction was like throughout many applications, but it wasn't defined, as well as participation wasn't defined. So it's really hard to measure over the course of a year whether someone is, you know, meeting the participation goal outcomes as well as the satisfaction goals. So I would just like a little clarification about how you're measuring, you know, satisfaction with housing, as well as like community connections for the people that are participating in the program. So all these they seem very good, but I'm not sure how they're measured.
Kim?
Yes.
You've been talking for 5 minutes and I'm having trouble following everything that you're saying. So if you could just quickly summarize what are your 2 questions that you would like to ask the agency? I think I heard you say something about cultural and linguistic competence and their board, and question about measuring outcomes. Did you have other questions?
No, that's it.
Okay, good. Then Debruce, did you have something that you wanted to add or questions that you want to ask, or should we have the agency answer those 2 questions?
No, I just felt like they well mapped their domains of need in the program. They have a large spectrum of support. It seems very individualized. Program is evidence-based. I think Dr. Fisher touched on that. And they do have outcomes. They do indicate outcomes other than just participating in the program. At least there seems to be some kind of measure of what the participation brings to the individual, probably through a survey. Anyway, that was all.
Okay, do we want to have the agency answer those questions?
I'm happy to speak to those things. Yeah, so first of all, in terms of our cultural and linguistic competency plan, I think probably similar to other agencies, we are always looking to expand and diversify our board. Our focus has really been in the last year, I would say, to encourage more self-advocates to get involved in our board, just as people who are using services and trying to make that a more accessible process for folks. But beyond that, you know, we are of course looking to encourage more involvement in our board, more action with related to our board. Our board does have a lot of families in it. That is kind of the main sort of, I guess, category of people who are on the board. But also looking for kind of community members and sort of a diverse spectrum of people who are using services to be involved in that. In terms of the outcomes, I think that was the other question you wanted me to speak to. Yeah, so I will say, number one, we have been working with the U of I's evaluation capacity team. This is actually the second time we've worked with them on this particular program. And we're in the process, we're still working with them at this point. And so the outcomes that we designed for this program, as well as kind of the measurement strategies, we did in collaboration with them. We did, find that page here. We have a number of different ways that we're measuring those things. I mean, because the program is really designed around people's kind of self-defined goals, we are also looking at, for a lot of those self-defined goals, like, do people feel like they have achieved that goal? Like, are they satisfied with where they've gotten with it? And that really comes from talking to the person. We also have sort of built into our kind of annual sort of planning and review some new measures about kind of both, like, you know, do you like where you live? Is it affordable to you? You know, do you want to stay there? We also have some like staff feedback from the people that are working with them most closely, like, you know, based on, you know, like staff support of their kind of, you know, financial situation and sort of all of these different facets of their lives. Does that person feel that their housing is stable? Like, do they have concerns that that person is going to, you know, kind of be an emergency housing situation or not? So there's a few different ways that we're measuring that. We also are using the personal outcome measures from CQL. For this program, we've kind of identified a few of the kind of key outcomes that we would like this program to be able to support people to achieve. You know, the personal outcome measures, they measure like the whole sort of spectrum of what, you know, life is. And so it didn't really make sense, for example, to say, you know, we want people to be able to get every single outcome, because one, that's not possible. And for two, like if the outcome that they're achieving is that they're going to, you know, have the kind of the work that they like, well, that's not really what this program is trying to address. Like, we as an organization are trying to address that, but in other ways, and that person might not be involved with our support there. And so we're kind of looking at those things as well as the supports, because there's the two components to that. And so ideally, you know, over time that the people are sort of involved in the program, they are going to be meeting those outcomes or achieving those outcomes, as well as finding support in areas where they maybe didn't have support before. So that one is kind of our, like, you know, very sort of validated assessment tool. We also use a independent living skills checklist that kind of looks at, like, what are the priorities for you to be able to live in the community? Because that may look really different from person to person. And so it identifies both kind of like where the person is at in a whole sort of gamut of skills. And then it kind of, by talking to them and talking to their family, what are the areas where, you know, this is a really big priority for the person to learn. And this is a really big priority for the person to maybe just get a little bit of extra support in, so that that sort of community housing situation can be stable. And then every year we're kind of then assessing, like, well, have you, you know, like, are you doing that thing? Like, that seems like the best way to measure. Like, you know, if you're saying, like, well, I don't know how to cook, and then the next year you ask, like, well, I'm cooking all of these things, so have you learned that skill? Like, yeah, that was a priority for you and you've learned it. So I probably talked too long, but does that sort of help clarify a little bit? Okay.
Yes, thank you. So you're looking for like an increase in those checklists, like, you know, matching like kind of a pre-post, as well as like interviews and explaining interviews with folks, explaining their satisfaction as a measure of you know, outcomes that the program is addressing the needs of the participants. Okay, thank you.
So there's some like initial assessment and then sort of complementary annual assessments that go with it.
Great. Okay, thank you for clarifying that.
Yeah.
Okay, thanks to everybody. I think some of these questions are really basic questions that apply to the whole organization, and all of the programs will come under that organization. Questions about the board and questions about how they measure outcomes are going to be the same for the different programs, or at least very, very similar. because we don't have that many organizations in our community. We have organizations providing different programs that we're supporting. So hopefully those answers will also apply to some of the future discussion. Yes.
This is Chandra. I just wanted to make sure that I stated for the board up front just about CLC for developmental disabilities and intellectual disabilities.
Okay.
It will look different than it will for the mental health board, just because of where they are on their journey in the process. The mental health board, just to let you know, they've been doing it a lot longer than the developmental disabilities boards, but DD agencies have received support, they've received training, and so where they are, especially with the diversification of the board, lots of times there just may not be the people present, and who they interact with just may not be indicative of diverse or different populations. So what they honestly look at are diversifications in skills, family involvement, just different ways of looking at developmental disabilities, intellectual disabilities. And with community choices, I want to clearly say they are impacting a system that normally would not have been impacted. When I say that, they actually have self-advocates involved with Visit Champaign County, which is a huge thing that promotes inclusion into our entire community. So I just wanted to just let you know, like, it's bigger than race and ethnicity. It really looks at a larger picture of our community. It does not exclude race. And I have to remind people, like, we're not excluding race. It is including race, ethnicity, gender, developmental disability, even within your family culture and your family styles. And so I just want to make sure I put that out there. So I'm not going to take up any more time.
Thank you, Chandra. That was very helpful.
Yes, thank you.
Really appreciate it. Okay, any more comments before we move on? All right, then I'm going to move on to the Developmental Services Center Community Living, formerly called Apartment Services. And I have myself as primary reviewer and Deb Rush as secondary. And I have just some very brief comments. This service provides multiple supports for people living in apartments. It's a little bit different than the one from Community Choices. The needs of the people may be differently assessed. They're currently supporting 64 people, and they said there were 6 screened. I pulled that from the document. Again, 90% are assessed within 30 days, which I think is pretty wonderful. CCDDB is 80% of the program revenue. Personnel is 89% of the cost. And they are requesting an increase for 2 more full-time equivalents, which they have assessed are necessary to meet the needs of the clients. They work cooperatively with Community Choices, with CCRPC, and this is an established program that I think has a good track record, and that's all I have to say. Deb, did you have comments or do you have questions for the agency?
I think you pretty much covered it. Regarding outcomes, I've noticed that DSC has built in some participant satisfaction outcomes in some of the other programs, but I really didn't see it in this one. So I'm wondering if that is a measure that is happening, but it wasn't listed in the application.
Is that a question for the?
That's a question for the agency, yes.
Okay, then let's have somebody answer that, please.
Sure. This is Sarah Perry, Director of Residential Services at DSC. And yes, we do complete satisfaction surveys annually that would be included in. We're really focused right now on using the tool that we did develop with the U of I collaboration, and it's data collection on safety and healthy living And we use an inspection monthly to gather very detailed data to help support the individuals on learning skills and being able to maintain a more safe environment. So, but we do satisfaction surveys annually.
Okay, thank you for that. And one more question, Sarah. Is this still, does this program services take place primarily during the workday still? Or
we do have schedules that definitely collaborate with when the individual is ready. Many of these individuals either have part-time schedules with day program, or they have employment in the community that could be on weekends and evenings. So it's when they're most available. A lot of our services are also medical related, which are during daytime hours. So we have to fill in the gaps. And we certainly work with their already scheduled time to make sure our time fits their needs. And then we also have the emergency on-call that we share with the service coordination.
But you all are just, you're definitely making an effort not to pull individuals from a supported placement to provide another supported service at the same time.
Most definitely.
Thank you.
Yep.
That's all I have.
All right. Thank you.
Thank you.
Good questions and good answers. Thank you very much. Any more comments on this program before we move on? Well, the next one is also DSC, and it's clinical services. And Deb, you're primary, and I'm backing you up.
Okay. I think it's the right page here. Okay, clinical services. Clinical services is a program that the DDB has supported for a long time. It was funded last year at $174,000. This year they're asking for $184,000, which represents a 6% increase. This program provides counseling, psychological assessment, and other clinical supports on an initial and or ongoing basis for individuals with IDD. They assist in planning and implementation of other supports, but recipients are not necessarily enrolled in other DSC programs. It has broadened its scope this year through increased recognition of mental health needs as they've increased in the community, including among DSPs. And therefore, they are focusing on increasing their investment in this area of need. The program uses a consultant model, which DSC believes works well because their team members get to know the individuals with IDD whom they serve. Therefore, they feel like they're minimizing the risk of misdiagnosis. Many people with IDD who have communication impairments, this program recognizes that behavior is communication, which often a manifestation of trauma rather than a component of disability. So they're definitely using a trauma-informed, evidence-based approach. The outcomes are clearly defined via quarterly reviews and annual assessments conducted by the clinical manager, as well as medication management and psychiatric notes, which are maintained by the psychiatrist. The program seeks to serve 59 people with ISPs, 10 eligible individuals without ISPs, and I'm thinking it's 10 intakes via phone or face-to-face, and 2 meetings or contacts to build awareness of the program. Other resources are not leveraged for the program, but other payment options are explored with each individual being served to minimize the risk of the DDD paying for Medicaid eligible services, and due diligence in this regard is expected. And that is all I have.
Deb, thank you very much. I'm looking at my notes and you covered everything on my notes except for 2 things. I particularly liked, as you did, the recognizing behavior as a form of communication and the trauma-informed approach that stood out. The other thing that I thought was really excellent is there's no limit to length of service. One of the problems that I've seen in mental and behavioral health is that payers put a limit on the amount of time and length of service, and this one is not doing that. Again, 90% of those assessed are assessed within 30 days and 90% have services within 30 days, which I think is really an excellent standard. So I don't really have any questions. Did you have any questions, Deb?
Not really. I just thank you for mentioning that there's no end to services. That's huge.
Yeah, I think we can feel good about this one. That's the way I feel about it. Moving on, DSC again, individual and family support, and Kim Fisher is primary and Georgiana Schuster is secondary.
I will try to be more brief this time for everybody. So the individualized and family support program provides day services, community outings, and in-home support for people with intellectual and developmental disabilities in the community. The program is going to support 46 people in the community. They did mention that there is a reduction in the budget because there is a reduction of a position. At least that's what I read in the budget narrative. So maybe we could get a clarification about that. But in terms of the rubric that we're supposed to be grading it on, they've met, they're meeting rural community needs, addressing anti-stigma, using evidence-based practices. I did have questions about the measurable outcomes, but I can save those for another time.
Georgiana, did you want to make any comments or ask any questions?
Just about the reduction in budget. I didn't hear very well what Kim just said, and maybe somebody could explain that to me better.
Sorry, Georgiana, I can speak more clearly. So they reported that there was a reduction in budget because there's one less staff.
Okay.
But maybe
is there an agency representative that wants to clarify that and maybe very briefly address the outcomes assessment, how you're dealing with that?
I can speak to the reduction in the staff position. I think we try to be really good stewards of your all's money. And what's happened over time is that we have had more people in this program who have gotten state funding through home-based support awards. And so just in recognition of that, we felt like we needed to reduce on that end.
So your reduction is not because you can't find people to work. It's more that you don't need that person.
That's right. Although we do also in this program experience ramifications of the DSP shortage. So, but no, it was more the fact that the population or the funding sources for the individuals served changed.
Thank you.
And then can you just clarify, like, on the outcome related to satisfaction, is that provided to families? Is it provided to recipients of services or children or adults with IDD that are in the program? Maybe for children, you would think about families, but how are participant satisfaction gathered?
Sure. The formal documentation that we receive is as a result of a satisfaction survey that, typically it would go to the individual or their guardian. The individuals that are supported in the day program for this program typically get the responses from their guardian. They tend to be some of our most involved individuals. So I think part of the satisfaction we get from that, or the knowledge of the satisfaction that we have for the participants, is just anecdotal through the participation that they have in the community and, some of the activities that they enjoy. But we did get the formal documentation from guardians typically for these individuals.
Thank you.
Thanks.
Any other questions or comments before we move on to PACE. And I have Deb Rush as primary and Kim Fisher as secondary.
Okay. All right. Okay, the PACE program is titled Consumer Control and Personal Support. It fits under the priority of personal life and resilience. It was funded last year at $24,267. They are asking for $27,367 this year. That's a 13% increase. The application does indirectly address how the program will improve the quality of life, in as much as there is the expectation that having a compatible personal support worker would help in development of independent living skills, self-advocacy, and community integration. When I look at this application, because this is not a new application, we've funded this for a while. I keep hoping to have independent living philosophy or some other credible research cited in the application as evidence for this program's approach. Independent living philosophy is all about person-centered, but there's really nothing cited. Referring to the application review checklist, I had to leave a few things blank. I couldn't answer yes to some of the prompts for minimal responsiveness. The application states that 65 people have completed orientation, paperwork, and background checks over the life of this program, I believe. I've lost track of how many years we have funded this program. It's several. This year, PACE expects to train 30 personal support workers. I think that's the same number as last year. Of those 30, only 3 are expected to match with a person. I understand that consumer choice is a really good thing and that it both drives and limits the number of matches, but that number is discouraging to me. So I have some questions about, historically, once a match is made, how sustainable has it been? What percentage of potential personal service workers remain ready for service on the registry over time? And it's, you know, in the face of very big need, how do we rectify, come to terms with the fact that we're paying to train 30 personal support workers and only expecting that 3 of them will be available to provide support for our population?
Do you want to have the agency answer that question, Deb?
We could, or we could, Dr. Fisher, do you have questions or comments? Maybe we could wait until after.
No, I think you covered much of what my concerns were, Deb, very clearly.
Okay, thank you.
Okay, can you, Deb, could you restate the question that we want to ask the agency?
Okay, there are really several that all really kind of domino upon each other, I believe. They expect, there are 65 people on the registry or have been trained historically that we're aware of. How many of those 65 are still on the registry? Of the 30 people that they train this year, why do they expect to only have 3 matches, and why did we only have 3 last year? That's about it.
Okay. Is there someone that would like to respond to those?
So this is Sherry. I would like Mel to respond because she knows those numbers better than I do. I see she's raising her hand too. Go ahead, Mel.
Thank you. So I know our expectation was 3 because from this year, but we actually doubled that. So during the pandemic, we have a lot of consumers that reached out to us and stuff that were looking for referrals. And I know our goals was last year was 3, but we actually doubled that amount that a consumer was able to connect with a PSW. I do wanted to say we do with the person centered, it is when the consumer calls me, I do value their preferences. And I always, you know, with them, me providing referrals with them and stuff, it is totally up to the consumer who they want to pick for a PSW. So we do have around, like you said, about 65 people, and I do update their background checks. So some of them, if they don't update, they become inactive, and I do reach out to them at least every quarter to make sure they are responsive to the consumer. So, but ultimately it is a consumer control program. So I do provide as many referrals as possible to that consumer, but it is up to the consumer if they like that PSW. So, so it is an independent living philosophy for us that it is, I cannot recommend one over the other, a PSW. It is up to the consumer. I'm providing as much referral as possible so that they get that possibility of they find the connection. And we do provide an advisory every quarter that that increase or teaches a relationship and possibly work with the relationship of employee-employer so that they can sustain that relationship throughout that employee relationship. Does that answer your question? Do I need to clarify anything on that one?
And so you, at this, just one question about the registry itself. You still have 65 people registered on the registry who are available and ready for service?
Yes, about 60 to 65 and stuff. So, because it is, I do make someone inactive or active if they do not respond to me within 5 working days when I try to update their information. Because as you know, with the increased need for both personal assistant and personal support worker, a lot of people could get grabbed and find employment that when I update them, they become inactive. So, and I cannot refer them out because they have fulfilled and was connected to someone.
How long are they active on the registry before you deactivate them?
So I reach out to them at least every quarter, but within 5 work days. 5 work days, if they do not reach out to me either by email, by text, or by phone, I will make them inactive because I feel like if they're not reaching out to me within 5 work days, they are not reaching out to the potential employer that they have.
Okay, thank you.
Any other questions? All right, I'm going to move on. Georgiana Schuster has a time limit for this meeting and she has primary responsibility for the next 2. So Georgiana, are you ready to talk about Community Choices Customized Employment?
I am. But I wanted to start with someone from Community Choices, maybe Becky, to just give me, in 25 words or less, kind of the flow of how you get your client, how you the first thing you do with them, needs assessment, and just the flow of a client through the system of community, customized employment.
Sure, I'd be happy to. So we, anybody who uses services with us does do an intake with our membership coordinator, and that's just to kind of verify just the general eligibility for all of our programs. That meeting is usually set up depending on kind of when the person reaches out to us and what their schedule is like. Almost always it's within 2 weeks that we get that done. And that's, again, just that kind of initial getting the paperwork verification. From there, usually if they call us letting us know they're interested in employment, they will ask Ashley, our lead employment specialist, to sit in on that meeting, and she'll give the person or the person and their family just the general information about how the employment program works. If they still want to move forward, Ashley usually sets up a meeting then with them to meet in more detail and kind of go over how our program works. If we have a waiting list, which we don't have a very long waiting list at this point, we will kind of add them to that as soon as they've said, like, hey, I want employment. From then, we do try to start our discovery process with them within 30 days of them being on the waiting list. That discovery assessment is done over the course of usually about a month. In at least 4 or 5 meetings with the person. It's a very kind of, it's not a assessment where you're going to pass or fail. It's really based on observation, based on building rapport with the person, and kind of understanding where their strengths and interests are. And then from there, we have a team meeting, we decide on themes for employment, what some ideal conditions would be. And from there, the person and their job coach, employment specialist sort of begins the job development process where they're actually going out and looking for, applying for jobs, shadowing jobs, that sort of thing.
So it sounds like the whole process could possibly, well, if someone says, yes, I'm interested, then they will start that discovery process within 30 days. And it might take another 30 days to go through the discovery process. And then, I don't know, is it difficult to say how many months it might take to, find the right position for someone?
Yeah, we've been collecting data on this for the last couple of years, and it is extremely variable. Some people it takes a month, and sometimes it takes 2 years. So I could give you an average, but I don't know that it's really going to tell you anything that helpful. And we really do try to make it very personalized. And so if somebody has very particular kind of desires related to their employment or needs related to what that employment environment is like, it might take a little bit longer. Some people come to us and they're like, I don't care, I'll do pretty much whatever. And so we'll get to know kind of what they're, of whatever, what seems the best. And that is often a little bit, it's easier to find a good match. But that is something that we do keep track of. We also keep track of if that position that they found is something that matches one of their employment themes. And so these are kind of like the sort of the broad ideas that we sort of frame our job search around. So, if the person has, if they're really interested, in food, we might look at restaurants. We might also look at kind of other aspects of different types of jobs that could involve food. Like, well, what part of it do you really like? And kind of, it's designed to be pretty broad to try to create like a lot of, creative options for ways that we could find a really good match for that person. And then once they do have the job, we keep track of it and see like, well, did this job, like, if you said your theme was food and we get you a job, sweeping floors in a warehouse, I don't know, probably not. And probably not a good sort of match there necessarily.
And your increase in request is just 8%, but is that just due to increases in salaries and costs in general? It's not that you expected an increase in users of your services?
Yeah, that's correct. It's related to a cost of living increase for all of our staff, and we're also looking to add additional benefits. At this point, we haven't had any type of kind of retirement or dental insurance, and that is something that we're looking to add to try to retain the staff that we do have and be able to bring in new staff when we need it, which has been harder and harder.
And the harder and harder part I get. I don't have any more questions. Would Kim have any questions?
So I just want to clarify. So I read that you're going to be supporting 12 more people this year. Did I read that correctly? There's 12, 28 people continuing and 12 new, or is that not for this?
I think it was correct me, I could be wrong. I think it was about the same number of people. It might have been slightly more related to the first-time job seekers program, our workforce empowerment program. We thought we might kind of include or get interest from some people who maybe wouldn't necessarily have asked for our kind of classic customized employment services. So if there wasn't a small increase, and I'm sorry, I don't have the number side by side in front of me, I remember kind of going through making my best estimate. And I think it was related to that.
Okay.
Additional interest there.
And then the other thing is the outcomes are clearly measurable. When I read them, I can see okay, if this is what your target is, and there is a way to measure that. So I thank you for making this very clear.
All right, well, we have the same team for the next review, and it's DSC Community Employment. Georgiana, are you ready?
I guess I am. What could I ask someone from community employment to just give me their, kind of down and dirty, 25 words or less, kind of the flow of how things work from the time someone is referred to you to the time, well, I don't know, there's probably no ending date, but just kind of a flow of how it goes. Somebody do that?
Yes. Yes, good morning.
Yes.
This is Annette Becker. How are you all? Our processes are very similar. Just like Becca described, we work one-on-one with people who have identified that employment is something that they're interested in. We do the discovery process, spending time with the person, spending time with people who know them well. Some of the people that we work with, we actually are very familiar with because they're part of our in-house program, and they're interested in employment. And what we do with the information that we gather, both verbally and also just through working with them, getting out in the community, we develop an employment plan that also identifies 3 core directions that people are interested in going in. And then some of the other things we're helping people with are the soft skills, going in and just meeting employers, making eye contact, having conversations, really feeling more comfortable with their self-presentation. People come to us at different points of readiness for employment. And again, we identify kind of where they're at in that process and then help them continue in that job readiness. And it can be anything as basic as they say they want to work, but we schedule meetings with them and they have a hard time making it to meetings or, following through with commitments. So we're working on, even basic steps like that. Becca mentioned also that, kind of identifying how long it takes to help somebody get a job. There are just so many variables, everything from the employment market, what the person is interested in, and just their comfort level getting out there. Recently I mentioned the young man that we had worked with over 2 years, and he's finally gotten a job. And we just really want to take it at the pace that the person is comfortable with, because especially if this is their first time job, you can only have a positive first experience one time. And if the first experience is not positive, then I think that makes it that much more difficult for them to feel comfortable getting out there again. So really taking that time to get to know the person, what they're interested in doing, and sometimes helping them. If people just say, I don't know what I want to do, it's helpful to give them different opportunities to say, nope, I really don't like that. Or, hey, I didn't think I would like this area, but I'm really interested. Just one brief story. A young woman at one point said that she really wanted to work in daycare. And so we set up an opportunity for her to volunteer at a 1-week summer camp. And after the first day, at the end of the day, when she and her job developer were talking, she said, I do not want to go back. I do not like working with children. The reason she had identified that as an area of interest was because her aunt, who she dearly loved, had a daycare in her home. So if we had just listened to what she said initially and pursued that, that would not have turned out, to be a good outcome. And then continuing to work with people after they have the job, helping set up the connections between their supervisor, natural supports, helping to identify new job responsibilities, or sometimes identifying potential red flags. If a boss changes, if one boss leaves, and another one comes in, then, does that mean a different level of support for the person who might need that to maintain that job?
Thank
Okay,
you.
thank you.
That really good. Yep. I don't have any other question. I have a question that has shown up on most of these applications, which maybe I could ask right now and get a quick answer to, but it's under service contacts. Someone is, each of the applicants has asked for, or is asked about how many service contacts you have. And I'm having difficulty understanding what is the difference between a service contact and other. Can anybody explain that to me? I know it's just part of our application process here, and you're just answering a question, but.
I'd like for Kim Bowdry to answer that. A contact, I believe, can be a discrete episode. The other are typically hours. So an episode isn't always equal to an hour. But Kim, is there more to it than that?
Well, those are agency defined. So some agencies define those as any interaction with a client or potential client. Some agency define those as phone calls or outreach to potential clients. So it depends on which program and which agency. Other is usually hours, and that also varies by the different programs and how they have defined that. Does that help at all? I mean, it's hard to give a very definitive answer to what those mean because they do vary so significantly across the program. So the description that the agency and program wrote in their application is included in the long program summaries. And you can see kind of how those do vary across the different programs. I don't know. I don't think I'm explaining it well, but to try to say this means this and this means that it's difficult because they vary.
We do have some guidance about what it should mean, but then within the category definitions, agencies can use them in ways that are relevant to their particular program. Could I make a comment about something totally unrelated?
Yeah.
I'm talking. I want to apologize. At the bottom of page 79 in your board packet, there is an error. I don't know where this sentence came from, but this could be why, Kim Fisher, when you were talking about the increase in TPCs in that community choices program, there isn't one. So I do not know where that statement came from. I believe it's on page 79. It says significant increase of TPCs. There's no increase of TPCs. So I think this is a copy paste accident that we missed. Sorry.
Well, actually, so I was looking at the, and I don't know, maybe I did the old school paper version. So I was like, well, maybe I mixed up the table. So in the customized employment for community choices, I was looking at the table. It kind of looks, I don't know if you might not be able to see, but it says like, it's a table that says like continuing TPC, new TPC, total TPC, and then the NTPC numbers. So it said 28 was continuing and 12 was new.
Right.
And there's 40. I didn't know if it's possible I'm misreading these, but that's
I think that was right. I really want to apologize so I'm glad that it wasn't my mistake that was misleading, but just for the record, that's our mistake. I'm crossing it out. But
This is Patty. I just wanted to kind of follow up on Georgiana's question about the service context specific to this program. In the summaries under utilization, production, data, narrative, there's a definition for every one of those on the part 2, and ours for that specific program is service context that includes contact with people or anyone in their support network seeking information about our community employment program. So it is defined in every application, and like Kim said, might be different for every program, not even just every funding request, if that helps.
Well, is there also a definition for other?
Yes. Ours is NA for that one. But yes, it's all there's underutilization production data narrative. It talks about the treatment plan, client definition, non-treatment plan, community service events, service contacts, and other. So that's kind of where that shows up in the application.
All right, I don't want to belabor that little detail too long.
That's just part of the format of the application. So everybody's application would have that.
Yeah, and it's really not a fair question for you. It's a fair question for CCDDB that puts this application together. Yeah.
So the agencies don't have to use all the categories either. They choose the categories which are most relevant to the program they're proposing. So that's why you don't see other in that one. But sometimes other is just direct service hours, and those are reported in the service claims system. And that's why there's a comment there about the service claims system.
Okay.
I do have two questions.
We probably should move on. Yeah.
All right. Thank you. Being the time monitor here, it is 10:30. We have completed the review of 9 out of the 15. And I understand Georgiana is going to have to leave early. I wonder if we should go in a different order and let Georgiana finish her primary review before we move on. Georgiana, do you want to do that? Is this putting too much pressure on you, or how do you feel about that?
I can do that. That would be helpful to me to be able to.
Okay, well, why don't we just jump ahead then to DSC Workforce Development and Retention, where you are the primary reviewer. And then your last one that you're the primary reviewer is the Head Start, early Head Start.
All right, let's do the DSC Workforce Development. That sounds appropriate. It is the first of its kind. We're talking about, figuring out how we can get more people to work in this line of business and keep them, not only get them, but keep them. And I think that this is a wonderful attempt. I hope it works. My first question is, somewhere on the application, it says this is a 2-year consideration. What does that mean?
Hi there, this is Patty. We were looking at trying to focus on training, support, recognition, and reward, and feeling like 1 year would not make a significant dent in a long-standing issue related to staff vacancies and high turnover. We recognize that that's, that it's a big ask, and 2 years may not be reasonable, but wanted to at least mention that because we think that the answer isn't kind of a one and done. So that's kind of where that request came from.
So this request for $227,500 is really just for 1 year, knowing that we probably will go into a second year to make sure that this is working.
That is the request, yes, that that is the annualized amount. And if it's approved for 2 years, we would do that over the course of 2 funding cycles.
Ah, okay. And so let me reiterate what I think I've read in here is that what you're hoping to do is have a membership in the NADSP. And I wanted to know, does NADSP already exist?
Yes, it's a national alliance that has offers a lot of support. There's a Facebook page that's a great resource for DSPs if they want to connect with others across the country or the world. They offer individual memberships, and they also offer provider memberships. And with those provider memberships, you get discounts on training. And some of the training that we're looking at is really focusing on frontline supervisors and that kind of mid-management level, because they're making a shift from DSP to mid-manager. And sometimes they've got a really great skill set, but it doesn't necessarily transfer. But recognizing that 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 midnight supervisor, it may be the difference between somebody staying or leaving based on the training and the support and the philosophy and values of the agency. So with that DSP training, they use a lot of CQL. NADSP has a board member on someone on the board for CQL, and CQL also sits on their board. So there's a lot of overlap in so priorities and philosophy revolving around person-centered planning. So that's kind of where that came from.
You said the word CQL. I don't know what that is. Say that again.
The Council on Quality and Leadership. So Community Choices and DSC are accredited through CQL, which is in years past, there's different accreditation that you can seek for your organizations, and CQL is the one that shows best practice, person-centered planning, really looks at rights and choice, and just making sure that people with disabilities have the same opportunities as those without.
Okay, so to go on, what the plan is to pay people give hiring bonuses of $500 to a new person, and then retention bonuses of $500 3 times during a given year. And also, I think bonuses for completion of training. Is that in addition, or is that part of the retention bonuses?
No, so it's actually 2 different groups. So the retention bonuses are for people that have already been employed by the organization. And then the new employee there's mandated training that is required, whether that's DSP training for adult services, QIDP training for service coordination. There's expectations for the family development, the children's program. So as soon as a new employee completes all of the new hire training, there would be a $500 bonus for a new employee. And then it would be a separate pool of money that would recognize longstanding employees. I think we may have said that they had to be here for at least a year, but I'd have to revisit that. I'm not positive. But it's retention bonuses for people that really are doing a lot of the overtime, picking up the slack for staff vacancies, that have been here kind of for the long haul through the various challenges that a DSP crisis has kind of impacted the whole workforce.
And will or do all of your trainings now come from this national alliance, the NADSP? Do the trainings come from there now, or are they going to come from there?
No, by joining in an ADSP, we would have access to some trainings that we don't currently participate in. Right now, the DSP training that staff get is upon hire, and that's that 40 hours of classroom and 80 hours of on-the-job training that's required. The state is looking at revamping that and changing that a little bit, which will be a really nice thing in the future, because it'll be more specific to their roles in whatever programs that they're working in, and not just a kind of a general overview of a variety of topics. So it's more targeted, and there's a whole bunch of options that we can choose from to cater specific to our field and to our programs. So it would be a new relationship.
Okay. Well, I don't have any more questions about it. I really am gung-ho about trying this. I hope it can work. I hope it makes a difference. And so who is my second on this? My secondary.
Yes, I'm the second, and I would second everything that Georgiana said, and thank you for this discussion. And I guess I did not understand that we could approve this for 2 years, but I have written that down and want to be reminded of that when we come to our meeting next month.
Okay.
And kudos for creative thinking in this really important area. Okay, Georgiana, do you want to go on to your last one that's your primary, which is the Head Start, Early Childhood Mental Health Services? And Kim Fisher is second on that.
Thank you for letting me jump ahead here. All right, this is kind of a not hybrid program, but it's funded by both our agency, the Mental Health Board and the and the DD board. And so our portion of it, the DD board's portion is 149,666. And it is regarding early childhood mental health. And it is run by Champaign County. I guess by the RPC, is that correct? Or is it another agency that I'm not aware of? Does somebody from?
That's correct. Also, just to let you know, it's only funded by the Mental Health Board, but they have a set aside for DD dollars. So that's the, they would contract for the whole thing, but they would only do the DD part on your advice. They're reviewing it as well.
I see. Okay. All right. So maybe someone from this agency could give us just a quick flow of how someone comes into using the services, and families and young children come into using the services, and just a maybe 25 words or less, quick flow on that.
Yes, I could speak to that.
Okay.
I raised my hand because I wasn't sure what the protocol here was, but and so my name is Elise Belknap. I'm the early childhood mental health consultant that works with the Regional Planning Commission's Head Start programs. Jody McGee is also here. She's the director of the our disability services, our mental health program, health, nutrition, all of that stuff. So she can feel free to jump in at any point too. But so in terms of the flow of how services are provided, people are identified. Within the first 45 days, a child enters into Head Start. They are screened using the Ages and Stages questionnaire and the Ages and Stages questionnaire social emotional screening tool. And with that screening tool, we're able to do some initial identification of, are there concerns here for this kiddo? What do we need to work on in terms of goals? And are we at a point where a referral would be an important next step to either early intervention or to the school districts, or even to like a developmental pediatrician, Carl, Christy, something like that. And so a big part of what we do, the coaches do, the social emotional committees do at every single site, as well as our offsite programming, is monitor that screening process and make sure that nobody falls through the cracks, identifies social emotional goals when they come up, and help facilitate the referral process to special services or early intervention services, as a collaborative process with our parents, with our family advocates, with the teachers.
Okay, so a child and his family enters through Head Start. That is the beginning point. And
yes,
and all Head Start kids get this social emotional assessment.
Mm-hmm.
Correct?
Yes.
Okay.
Correct. Yep. There's the Ages and Stages questionnaire looks at more than just social emotional concerns. It also looks at fine motor, gross motor, problem solving, communication, personal social. And what we found in the last year since the pandemic, that we are seeing a really sharp increase in children who are in kind of the concern area for fine motor, for communication, for problem solving, and for personal social, in ways that we hadn't seen at those numbers before. So our services have actually increased in terms of like the number of children we're monitoring, and the referrals that like the work we're doing in the classrooms related to those things. But I suspect the pandemic has played a role in kids just not getting the practice that they need, the number of hours they need to put into building those skills. And that's kind of how we talk about it with our teachers, is that like the kids are where you would expect them to be based on the practice they've had to date doing those things. It's not that they are, there's anything wrong with them, but they have not had enough opportunities to do the fine motor activities, to practice their communication, to engage in problem solving with their friends because of the pandemic. And it's, we're seeing kind of developmental, like kids, our 3-year-olds act more like 2-year-olds. Our 4-year-olds act more like 3-year-olds. And that's across the board at the school districts as well.
And well, just one more question that which probably speaks to what you're speaking about, the increase in referrals that you've had since the pandemic. It looks like on your utilization and production reports, you've jumped from actual program year 21 to actual program year 22, from 45 people to 400 people. It's huge.
Yeah, we started to notice that increase in the beginning of the year in the classrooms. And so we started to be paying closer attention to the ASQ and ASQSEs, which we'd always used, but was particularly the ASQSEs were filled out by parents and then filled out by teachers, and it didn't always match because what happens at home and what happens in the classroom, they're different environments, different relationships, but we're starting to see those match more often. And the way that we are identifying who's on a caseload has shifted a little bit too, so that contributes to that greater number, because the fine motor piece and the communication piece all plays into then the social, emotional, the behavior, the problem solving. It starts to kind of pull and affect each other. So there has been an increase, but we've also shifted a little bit in how we capture a caseload.
Well, I do not have any more questions. I think it's a good program. Does Kim have any questions about this? She is my second on this.
Thank you, and I apologize, my computer shut down, so I missed some of the I was out of the meeting for a bit, so I might have missed this. So is someone who's very interested in measurement and outcomes, I would just say that if you could kind of walk me through a little bit the outcomes that you are measuring, so I can see, you have tools, validated tools that will measure the outcomes, but you have demonstrate improvement. And so how are you defining improvement in the outcomes? That would be helpful to clarify.
Yeah, sure. And thank you, Lynn, for pulling that up on the screen. I'm assuming that's you. A big part of how we determine improvement is through these validated screening tools and assessment tools, right? So the ASQ, SE, the DECA, and we also use Teaching Strategies Gold, and all of those are normed based on what we would anticipate based on like development, chronological age. And so when we screen over a period of time on multiple points, so the Teaching Strategies Gold looks at, I think there's like a 3 or 4 points over the year that we measure. The ASQSE we do, an ASQ we do every 6 months. The DECA we do at the beginning of our services and the end of our services. And that way we're able to identify sort of a pre-post or overtime. And we're also taking into consideration how parental stress levels, teacher stress levels in terms of working with children. And like, are we seeing reduced incident reports in the classroom? Are we seeing an improvement in the skills we're working on with the children to replace the like maladaptive behaviors in the first place, right? Like, to use a technical, a clinical term, but yeah, we're really, at the end of the day, we're looking can this kiddo get their needs met in a way that allows them to function well in these public group, social, family relationship settings? Or are they getting their needs met in ways that hurt their relationships, make it hard for them to be engaged in school, and things like that? So that's a really big part of our focus, and you can feel the difference in the classroom when it's going well and when it's not.
Very good. So a positive trend line in these measures, or just even an increase, even in the slight list between pre and post, is what you're looking at. Okay.
Yeah, and how does that map onto like, so for the DECA, for example, it looks at in the screening tool, is where does this kid fit in terms of initiative, self-regulation, and attachment? Do they have, is it an area they need support? Are they typical, or is it a strength? And so there we're able to determine, like, have we moved, has this kiddo moved from an area of need to a typical space?
Or what you're doing is working or not. Yeah.
Right, exactly. And we can also, it also measures behavioral concerns. And so is that decreasing in our pre-post?
Excellent. And then is there like an interview piece of this? So like, these are these are measures, but where do you kind of capture teachers' stories, family stories, kids' stories in these outcomes?
I love that question, because I think that, to me, that's the part that, like, right, that subjective qualitative experience at the end of the day, that's what matters to the parents, that's what matters to the teachers, not what it says on my report, right? Our approach is very relational. I do a lot of work that's reflective with our teachers and with our parents and our managers to sort of create an environment that those stories get shared and heard. I would say we, due to like our numbers and the time, like I don't document that the way, and also confidentiality. Like I don't have a system for like that kind of qualitative data collection. We do take notes, throughout our meetings and things like that, but they tend, we listen very intently to these stories. Do we write them down? No. Should we? Maybe. Maybe. I like that question.
I'm sure they inform your practice though, right? Absolutely. So when you're so you're meeting with families, and then that informs the next kind of steps in the work that you're doing.
Oh yeah, more than anything else.
Yeah,
absolutely.
Okay.
Yeah.
That would be cool to capture that, like in and out, like, so not necessarily, to your point, wouldn't want to share anything that, purport to us or anything, but how you all use not only these validated, reliable measures, but also that you use family stories to inform your practice. And that's just what you do anyway. I mean, all of y'all, no matter, not just Head Start, I mean, everybody in this call does this work. And I think to capture that is really important, because ultimately we are trying to show the public that we're being good stewards of money, but also improving the lives of our fellow community members. And so the more we can capture that, I think it's better for everybody.
Yeah, no, I appreciate that take. Yeah, I'll be thinking about that.
That's all the questions I had. or comments? Oh, and just real quick, actually, you were gonna cover 10 more folks, is that right? I might be reading this table incorrectly, but I like that you have currently 10 TPCs and you're gonna increase to 80? Or increase add new 80 new TPCs for a total of 90?
I don't have that in front of me in
Okay.
terms of like, oh, next year.
Yes,
As in like that's our goal. Yeah.
Yes.
So we had 10. Okay.
The target is the same. It's 90 again, 90 last year, 90 this year.
Okay. Yeah. And
I'm sorry, I'm
and
reading top to bottom and I should be reading left to right. Is that right, Lynn?
Yeah.
That's probably the problem.
That chart is kind of hard to look at. Sometimes it's not aligned correctly.
No, it's just my reading comprehension skills. No,
Well,
it's my fault.
no, it's a visual issue with the system. That's why in the program summaries, it's organized in a table, like it's 90 TPCs again, but I don't know if I made a note about, 80 new and 10 continuing is what you're seeing for a total of 90. And that's the same as this year. But
yeah, and I would just say
we exceeded that this year. So
yeah,
that's the thing, is that every year, really, depending on what's happening in the community, those numbers can fluctuate from year to year. I mean, some years we're like, everyone's doing better than, and other years we're like, oh my gosh, there's so much going on. So it's hard to predict.
Thank you. Thank you for your work and thank you for answering my questions.
Thank you for your questions.
Okay, well, thank you also. Georgiana, do you have to leave at this point?
I do. Yes.
Okay, you are secondary reviewer on 2. I guess if you have questions, you can contact Lynn or Kim and maybe they can help with answering your questions. And I appreciate your participation. And I'm sorry that you have to leave early. We only have 4 more to review. It is now almost 11 o'clock. I'm hoping that we can terminate this meeting by 11:30 because some of us have other commitments that we have to do pretty soon. So,
and I have a question. Do you want to
yeah.
go back to where Dr. Fisher had a couple questions? If you still have
I
know
don't
where-
remember any other questions that she had.
Yeah, she said she had a couple more questions about the DSC community employment application.
I did, but I wanted to, let Georgiana move on. The questions I had thank you, Lynn. The questions I had that related to kind of the services disruption during the pandemic and how DSC has kind of handled that, particularly in the rural communities. So they talked about reaching out into the rural communities to get customized appointments. So I just was interested in if they could clarify like how their services have been impacted through the pandemic and how they've handled that. And then also just to clarify the outcomes. So outcomes are, for example, people will actively participate in job development activities, including job club and employment discovery, and then measuring that outcome. The way that you would measure that didn't seem to match what the outcome was. So if they could clarify, what do they mean by actively participate? How are they measuring that? Satisfaction, etc.
Okay, I'll try to answer those, and I probably will only remember about 3 of the 5 questions. So if I miss them, please let me know. So starting with the disruption of COVID, we actually had a good number of people that we supported who were considered essential workers and continued employment all the way through the pandemic. We did continue job development efforts with people who were interested, but that was pretty intermittent based on the ebb and flow of, the COVID infection rates within the community. and just people who said, yes, I'm interested. And then as the outbreak increased, then decided to put a hold on things. The young man I talked about at the last meeting, who it took over 2 years to help him find a job, he was a great example of somebody who really was negatively affected by that stop and start process. But a good number of people we supported, who we provided job coaching to, were essential workers and continue to work. Could you tell me your next, did that answer that question?
Yes, thank
And
you.
then could you tell me your next question again?
Yeah, so the outcomes that you have for the program, I'm not clear how you're going to measure the outcomes. So for instance, outcome number 1 is people will actively participate in job development activities, including job club and employment discovery. So like, what is the level of participation? Is it number of times that they're going to be engaged in activities or in job club? How do you define participation?
It's really people who are open for services in community employment to begin that job search process. So that really is the number of people who are approaching us for our help in gaining employment. And that's both supported employment as well as your traditional employment, where we help somebody find a job and then fade back the support.
I think we can also just expand a little bit on, I think that the narrative that we have for that outcome is more clear to us than you, where it says a referral is completed for each person, an employment specialist is assigned, and monthly progress is documented. So they determine, the person and the job developer will determine the frequency of how often they visit and what kind of activities they're going to participate in. So that's going to be unique to each person. And then that gets documented. And so there's monthly progress notes that are descript, and we can reflect on those to actually find out the level of involvement and participation. And then the direct service hours are also reported. So it's just, I think there's a couple of different ways that it's being measured in that answer, and we could have been a little bit clearer with that. Does that help?
That does help, like that a lot. Yes.
Okay.
So I think like just in the future, getting some of that more specific information just is really helpful in reporting back to whoever we have to report to.
Of course.
And communicate to the community of how essential the work that you do is and how impactful it is.
Okay. So yeah, we can do better. Thanks.
Thank you for letting me jump in off schedule. And so that's all I have for this one.
All right. I'm sorry, I had forgotten all about those questions. Thanks, Lynn. I guess we're ready to move on. We have 4 more to review. And the next one is, I'm the primary reviewer, and it's DSC. On my cheat sheet, it says DSC/community services or community choices. But in the booklet, I see it just as DSC. So I guess my only big question about this is, how does DSC and community choices, how do they coordinate services? I understand that this is for LEAP trainings, and I can't remember what LEAP stands for, but it's something about frontline trainings for employers.
Right. Yeah, so this is an application and a program that both Community Choices and DSC do together. DSC is only listed because we have a full-time position, and so we take the lead on doing quarterlies, writing the application, coordinating meetings between Community Choices and DSC. But we have a staff person, and Community Choices has a half-time position, and they do the LEAP presentation together. And the goal is to educate businesses on the benefit of hiring people with disabilities, training those frontline staff who are natural supports, and then also now the introduction of the registry, which will hopefully help DSC and Community Choices kind of step out from between potential employers and people looking for jobs, so we can just provide an avenue for them to have access to each other.
Okay, that's very helpful. Thank you. So I guess the funding request for $85,000 or 95,000, what is it? $85,000 goes to DSC, but the effort is cooperative between DSC and Community Choices.
Right, and we
Our subcontract, which they will share with us, all subcontracts for services are to be shared with us for the files. And so this one involves a subcontract and clinical services as that you've already reviewed. So this is a contract with DSC and the DD board.
Okay, and then DSC subcontracts with Community Choices.
Yeah. Yeah,
Okay,
we
that
just
clarifies
invoice
it
them.
to me completely. Thank you. Deb, do you have any questions that you want to ask about this?
Not really. I appreciate the collaborative effort that two agencies have put together, and I just want to say I'm really excited about that Champaign County Directory of Disability Inclusive Employers. Appreciate that this year. I think you pretty much covered it, Dr. Rahman.
Okay, well, I agree with your comments. All right, Deb, are you ready to do the next? It's Community Choices again.
Okay.
Self-determination support.
Okay. Okay, the self-determination support application fits under the priority of community life and relationships, although I feel like it's really a very global application. It fits under a lot of other priorities as well. It was funded last year at $160,251. They're asking for $171,000 this year, which is a 6% increase. If fully funded, the DDB will cover 90% of the program's expenses. The application notes that the non-treatment NTPCs are expected to increase from 160 last year to 170. They've also noted in the application that their phone costs have doubled. Maybe some of those additional expenses are driving that additional ask. The program serves both individuals with IDD to make social connections, explore community opportunities, strengthen leadership skills and self-advocacy skills, as well as family members, where they target assisting family members to navigate the service systems, network with other families, and to become stronger advocates for their family members with disabilities. The program takes an evidence-based approach. It's well cited in the narrative. Outcomes are included in the way of surveys, which are utilized as measures of participant satisfaction. Percentages are listed in there. And then finally, about 180 co-op members, I believe, and their family members will be served, with the majority of activities occurring at community locations or in homes. 30% of the families are rural Champaign County residents. So it's a wide variety of activities that they provide. And Georgiana's gone, so that's all I have to say. I don't have any questions in particular. Anybody else have questions?
Okay, then we will move on. Thank you for that very good summary. The next one is DSC Community First, and I'm primary and Georgiana's secondary, so I'll try to do a review of this. This is a program that serves residents and peers for activities. They note that they've had 5 meetings and 2 formal presentations, or that's what they're planning to do. 27 offerings, which the range of them is tremendous. Everything from their podcast, which we have actually learned something about in the last year, and seems like it's really good. They have a Harry Potter club. They do Aquafit, and they had a number of activities and offerings that they were able to tailor to the needs of the pandemic. They have outreach to the rural areas. 25% of their participants are from Mahomet, St. Joe, Fisher, Seymour, and Rantoul. They cooperate with local park district and YMCA, the MTD. It's just a wide ranging and very cooperative project, and has been providing a lot of really good services for a while. So that's all I have to say. And I don't know, does anybody from Community First want to make a little comment about it? I don't have any specific questions.
Yeah, hi, this is Annette, and I think I speak to the Community First program pretty regularly during the monthly meetings. You know, what we're really doing is trying to develop leaders who will help their peer group, you know, kind of get out in the community and make decisions on their own. So it's just a great program. Thank you.
All right, thank you. Okay, the next one is also DSC. It's the Connections program. And I'm the second reviewer, and Deb Bruce, you are the first reviewer.
Okay. Connections, AKA the Crawl, was funded last year at $85,000. You're asking for $95,000 this year, 12% increase. It's a program we funded for a number of years. I tend to lose track. The application states that the requested increase is related to increased salary and benefits, as well as some other undefined increased costs. 95% of the program is DDB funded. The program offers its participants a creative outlet through artistic expression, as well as social connections that come with sharing their talent with the larger community. It also offers non-traditional employment opportunities. And from what I understand, participants are now offering their products, their art for sale year-round online. Yay. I appreciate that a participant experience measure will be added this cycle. Services are provided virtually to an extent. I'm imagining a good deal of that happened during the pandemic. It's not clear in the application, as noted, that who can access virtual participation. And then, you know, I know that transportation probably became less of an issue during pandemic. What is the status of transportation now for participants? Are they able to all get there? Is that transportation provided directly by DSC, or are there other modes of transportation? The program expects to serve 25 participants from DSC's Community First program, and 12% participants who are not receiving county funding, I guess Medicaid waivered individuals. 5 events will be hosted at the Crow, in addition to participation in other community venues, and the program will run for 120 days. If I could, I always forget this. So that runs for about 4 months, 120 days. And then after that time period, are other participants cycled in?
Do you want me to answer that
Yes.
right now? Yeah, so what we do, we have new groups that start every 3 months. It actually used to be every 4 months.
Okay.
But we do a survey at the end of each group rotation, and people said they wanted to go back to 3 months instead of a 4-month cycle.
Okay.
Yes, and so they decide, you know, hey, this is what we want to do that's new and different, sometimes based on something that they just dabbled in during the current period. And so those are offered, and so people can basically sign up for groups every 120 days now.
Okay. How many days a week is the building, the actual Crow, utilized in any given cycle?
Monday through Friday.
Monday through Friday.
Yes, yes.
Great. Okay. That's all I have.
Deb, I was just going to speak to, you mentioned the virtual reference.
Yes.
You know, that really was primarily COVID. It very similar to kind of what our family development program did with a lot of arts, crafts, and different things like that. The staff would put together the supplies and stuff and take them to people during COVID so that they could then participate virtually. It really isn't ideal. So the on-site, and actually last time I was there, I was given a tour a couple of weeks ago, and there's a really high interest in people creating their own music and writing and writing poetry and kind of putting it together. And they were doing some independent things with that was really cool. But that involvement with farmers market, there's a lot of things that I think opportunities that are kind of being resurrected since we're kind of coming out of the pandemic. This is a really fun venue, and I felt like the successes of it were squelched a little bit. So now that the public is kind of becoming alive again, we're excited about the engagement that can happen.
I was going to say that of all the programs, I think this is the program that was negatively affected the most by COVID, because it really is all about connecting with the art community. You know, we are already participating in Ebert Fest. We're doing another art and craft show and sale. We're going to be part of farmers market. So again, the ability to get out and to kind of pick up where we left off when we had such a successful open house. And then the very next week, COVID shut everything down.
Right. Okay, well, thank you, Patty and Annette.
All right, yes, thank you. I was going to ask if you're going to be participating with the art sale at Ebert Fest on Saturday, and just take this opportunity to announce that that is happening. And for all board members and other people who are listening, check it out. It's pretty fun. And you don't have to have a ticket to Ebert Fest. You can just go and look at the art that's in the tent. And I believe you want to tell us what the hours are. It's on Saturday.
We're going to be out there starting at 10, but the first film is at 10. So we've encouraged the artists to come anytime after 10, because there won't be a lot of action. So some people are saying they want to start at 10:30 or 11. It goes until 7, but I don't think a lot of folks will make it all the way to 7. The
That's
cutoff
long.
at 7, because that's when the sun goes down and we gotta leave. So it'd be great to see you all there. It's so much fun. And I will have, Chandra or I will have some tickets to the film that the Alliance for Inclusion and Respect is sponsoring. She's giving the tickets out right now, but if there are any left, I'll have some with me.
All right, I think I have little check marks next to everything. The only one that I have a question about, and this is for you, Lynn, it's under priority young children and their families. DSC Family Development, you have NA. We are not reviewing that. Is that mental health board?
Yeah, that's a mental health board 2-year contract.
Okay,
You know, the
all right.
mental health board has so many more applicants, maybe twice as many applicants as you all do, and a lot more contracts. So we've gone to a primarily 2-year cycle. It's just different contracts are on a 2-year cycle. So they put that one on, and that's why you're not reviewing it this year. Next year, if the agency applies for that, both boards will review it.
Okay, all right. Well, I think we have successfully completed, and I want to congratulate everybody for sticking with the program. I think all of the questions and comments have been very much to the point and very helpful, and they're certainly very helpful to me, and I hopefully to other people too. Old business, timelines and schedules are in the report, and I want to open it up for agency successes, because we didn't do that earlier. I think everybody's a little bit tired with all of this discussion, but does anybody have anything that they want to report on that's positive? We've heard a lot of positive things today, and thank you for that.
I have one super quick one, if that's okay. We actually kind of speaking to the question earlier about how long it takes people to find employment. We had a woman that we've been working with for 2 years start her job today at a bakery. She had a very specific, I only want to work at a small bakery. And it took a really long time to find one that was going to be a good fit. And she started this morning. So we're really excited, and you should all go buy cupcakes from Small Cakes down by Carbis Market.
Thank you. Anybody else? Well, I want to specifically thank all of the participants for being as great communicators as you have been today, and to all the board members for your great reviews of these programs and your very good questions. I have really learned a lot, and I think that this, I thought I knew what was going on in the community, but I think I know a little bit more in depth now, and I'm very appreciative for that. If there is I guess we've got two more things. We've got CCMHB input. Lynn, the CCMHB is doing the same thing.
They have, yeah, they have a meeting tonight, and then they also have a study session next Wednesday because, like I said, they have so much more to review.
Yeah.
And they will review the one application which aligns with their priority for very young children and DD, and that's the Head Start one. So we'll probably be seeing Elise again tonight, and maybe Jody as well. Anyway, yeah, they're on the same track. They have another item of business tonight. There's a request for consideration from an agency which missed the deadline. And I would like to say, given that that's such a tough issue, there's no consideration for late applications. So when it happens, it's a really big deal. I do want to say that the DD agencies did a really good job this year of timeliness, and their reports all tend to be pretty on time too. And we even had somebody submit an application, I believe it was 2 full days before the deadline, maybe even 3. And maybe I should say who they are, but for me, that was like, what? So, shout out to the DD agencies are doing a really good job of managing the reporting requirements with us and of communicating with our staff on any kind of compliance issues, and even on, more general, like the threats to the whole industry that I think this is a very healthy set of relationships right now, I think. Maybe. Seems like.
All right, thank you. Are there any board announcements?
And I just have a question about, our next meeting is May 18th. And so what will, in terms of the grants application, will we be discussing them, or what's the purpose of, this was it, right?
Yeah, and if you have concerns that you'd like to talk about further, Kim and I will be available. We have already started working on the recommendations memo. So the next thing is we'll present you with staff recommendations. We've got some feedback last year on the format of the memo. So we're redoing it a little bit to better support your discussion at that meeting. That is the discussion where you go yes or no. And we may even have some conditions that we want to include with some contracts if there are risks that you want to control for. So all of those topics are really important right now as we put that together. But whatever we bring you, it's just recommendations. That's our job. You all have to make the final decisions. Ideally, you would be able to make those decisions on May 18th, but if it takes longer, we could schedule a special meeting, probably the following week. Then the reason for this timeline is that it does take a minute to develop the contracts and get them all signed. And part of the development of contracts is that if the agencies have to revise anything in the original application, we got to go in and, manually open up every form again, and then they submit the revisions and we look at them. So, all of those steps take a bit of time unless everything is just perfect, So we usually like to have June, the first 3 weeks of June, to do that. So if you don't feel comfortable with the staff recommendations, or if you can't come to a full set of decisions on May 18th, I would request that you schedule a special meeting as soon as possible, but it could go all the way to the top of June and we could still get this done. Does that help?
Yes. And then historically, have there been sets of revisions that board has requested for folks? Okay.
Yeah, I think that's a very good question, Kim. And my understanding is that if you have special questions or concerns, bring them to Lynn and Kim at this point. That would be the best way to communicate about those. My hope and expectation is that the next meeting will be much quicker and easier because we've had the substantive discussion. And if you have a chance to get any of your questions that you have remaining answered, this was really a long, grind through meeting. And thanks to everybody for participating, because it makes the next meeting much, much easier. And my understanding from what Lynn has told me is that the budget is looking good, that we are actually in a position where we're not going to have to be slashing anything. We can actually say yes to the requests. So it's a pretty good year in that way. Well, thanks to everybody. I'm going to say that this meeting is adjourned.
Thank you. Thank you, everyone.